Okay, we're continuing with this book right here, Prevent and Reverse Back Pain by me, Pete Rogers. This is like part 4, fourth video on the book. We're beginning chapter 3, page 30, vertebral bodies and osteophytes. What are the 4 main anatomical regions of the spine? The neck is called the cervical region, cervical spine. The back, the upper back, also called dorsal spine, most commonly thoracic spine. The lower back is called the lumbar spine. And then down here, the part of the spine that forms the sacrum, the bottom, the back of the pelvis, that's called the sacrum, and the tip of it's called the coccyx. Okay. There's 5 lumbar vertebral bodies. That ends up being useful. You need to know that. Okay, if you're going to work in this area, you need to know there's 7 cervical vertebral bodies. Okay, so the big question is, are the discs alive? And yeah, we talked about that. Yes, they are. They run on anaerobic glycolysis. They don't have any blood vessels. They get glucose by diffusion from the end plate, and they extrude their waste products in similar fashion. What is a spinal segment? The vertebra above and below and the disc in between, that is a spinal segment. Okay, what is segmental instability? Abnormal motion between the vertebral bodies. When a disc is injured, what happens to spinal stability? It becomes abnormal. You can get abnormal motion. How does the spine know that abnormal motion is occurring? Because it has proprioceptors which can sense the abnormal motion. What is the main job of the spine? To protect the spinal cord and the nerve roots, okay? Why does the spine care about segmental instability? Because if you don't catch it when it's mild and it becomes big, it can cause movement of the bones such that they compress or tear the spinal cord and the nerve roots. So the spine has to deal with this problem. How does the spine deal with segmental instability? It lays down bone from the vertebra above and below. They grow towards each other to fuse that segment. Okay, so here is an x-ray, and it shows that, here's the sacrum down here. All the vertebrae are essentially fused. Here's L5, lumbar vertebra 5, 4, 3, 2, 1. We count going up typically, because you know where you are by the shape that this is sort of a trapezoid shape, whereas L5 is rectangular, so it's easy to identify L5. Then you just count up 5, 4, 3, 2, 1. Okay, I know inadvertently this one got labeled L1, 2. That was stupid, but that's how it is. Okay, when you get segmental instability, abnormal motion at the level of disc space level, the spine starts forming these osteophytes, these little bone spurs growing out. See how there's no bone spur here, no bone spur here, but there is one here, and they're growing towards each other, okay? This disc is narrowed, and this one will eventually soon start growing bone spurs as well. Narrowing of the disc space is typically due to degenerative disc disease, DDD, okay? So the basic question is, how do the vertebral bodies compensate for disc degeneration? Like we said, the spine protects it the only way it can, by growing bone spurs. The one from below grows it going up, the one from above grows it going down. They'll fuse in front, that's DISH, diffuse idiopathic skeletal hyperostosis. They can fuse across the vertebral bodies, interbody fusion. They can fuse on the back of the disc space, that's called OPLL, ossification of the longitudinal ligament. They can fuse all the way in the back of the spinal canal, ligamentum flavum, ossification of ligamentum flavum. They can fuse across the spinous processes, and that's called Bostrup's disease. Okay, those are the ways the spine can fuse itself. And the bone spurs not only fuse the segmental instability, they increase the weight-bearing surface of the vertebral body. Okay. What about the foramen? Well, the nerve roots exit sideways out the foramen, and bone spurs on the facets or on the back of the vertebra can push on those nerves and cause foraminal narrowing. The medical word is foraminal stenosis. What is degenerative scoliosis? When you get unilateral lumbar artery severe stenosis or occlusion causing asymmetric disc degeneration, so it becomes more narrowed, more loss of height on one side, and that will lead to degenerative scoliosis. What about the inner concavity of the scoliotic curve? That's sort of a stress point where you get accelerated degeneration. Okay. All right, that's it for this session today. I hope you found that helpful.